This is a really good question. What I think you're referring to is the different phenotypes that we have with PCOS. In other words, there can be different women that are diagnosed with PCOS that have different symptoms that show up for them. When we diagnose PCOS, or when doctors diagnose PCOS, women have to have 2 out of the 3 symptoms: irregular or absent cycles, high levels of androgens like testosterone, and or polycystic ovaries on an ultrasound, or follicles on the ovaries. So with this, we can have 4 different types of PCOS, one of them being you have all 3 symptoms. The next one, high androgens and irregular cycles and polycystic ovaries, and high androgens and polycystic ovaries. And you can see kind of where this would be important to differentiate, or why this is important to differentiate, because someone with irregular cycles and polycystic ovaries might not have the same presentation of symptoms as someone with high testosterone and irregular cycles. For example, one PCOS type might have more androgen symptoms, and another PCOS type might have more signs of insulin resistance. Now, from a medical professional perspective like your own, it is important to talk to doctors about what to look for with PCOS, because not every doctor is totally up to speed on what to look for when diagnosing PCOS. A lot of times they go straight for the ultrasound, but that may not be the only thing that helps to diagnose them. So what else besides the ultrasound can you ask the doctors? I would make sure that doctors are having a conversation with their patients about cycle length, or if they're even experiencing their cycle outside of a birth control pill. Like if they are not on the pill or under something that keeps them regular automatically, then they should be talking about whether or not it's present in general, if it's happening every 28 to 36 days, etc. And then additionally, testing for things like free and total testosterone can determine if they're experiencing high androgens from a clinical standpoint. They can also just look out for signs of high androgens beyond just the labs, like acne, losing their hair without a thyroid issue, and things like that. And one last thing that isn't talked about enough, I think ordering things like vitamin D, because PCOS women are often low, and things like insulin, glucose, and HOMA-IR, which is an insulin resistance test, can also help to distinguish if they're having PCOS related symptoms or something different.